I'm Sylvia Gordon.
Hey, I'm Rebecca Gordon.
Prior authorization has been in the news a lot the last couple of years. None of it has been good. And the pressure has been building on the Medicare Advantage companies, and they've been making some changes. It's gotten a little bit better in 2023.
Yeah, but they're not working nearly fast enough from CMS, putting new rules into place.
So the new rule that CMS is final now is going to make prior authorizations faster, right? So let's talk a little bit about the problems. United Healthcare, Humana, Cigna, Aetna, basically, I think maybe all of the largest carriers currently have class action lawsuits pending because of them just denying all the claims without even looking at it. It's crazy that it leaked out there that people are using AI robots to automatically deny claims.
And I hear that they're denying them within 5 seconds of getting the claim.
Or even less than that, which shows you they're not
even reading.
They're not looking at the medical records.
So on one hand, they're really proud of how fast that they can give an answer, but yet the answer is always no.
Right. So the new rule is going to, 1, speed up prior authorizations, and 2, give us a reason. If you're going to deny it, can tell us what's going on. So go ahead.
So the new rule is going to say this. However, why don't we say when the new rule is supposed to take effect? Because it's not 2024.
So if you read the CMS rule, it says primarily beginning in 2026. I don't know what that means.
So our hope for you is if you do have or you need a prior authorization,
it's in 2026.
I hope that you live long enough to get it in 2026.
Okay, so the new rule.
Carriers have 72 hours to give a response if it's an expedited request.
Urgent.
For something urgent, 72 hours. If it isn't, they have, I believe, 7 calendar days, which seems crazy.
Right,
it would take 7
they
days.
still need 7 days. But it said that some carriers are currently spending 2
Twice
weeks.
the amount of time.
2 weeks. And this wastes a lot of resources for these doctors' offices. So you keep calling the doctor, and they keep saying, well, we submitted it, and we resubmitted it, and we're checking on it. And it's wasting a lot of resources in the whole system. So nobody's happy, least of all your client.
Yeah, the person who needs the help.
Right. So one of the cool things is they have to give us a reason.
Wow, that's revolutionary. Tell us why we can't have it.
Why? Okay, so let's talk a little bit about original Medicare. Does government Medicare require any prior authorizations?
So, no, they don't.
Typically they don't. And they also have electronic API, so they can already read the medical records and see if it would be necessary or not. Okay, but they do actually have some prior authorizations.
And I would be happy to say these words, but I can't pronounce any of them.
But the easy thing is that it's for stuff that could be cosmetic.
So I'm all over that.
Anything that could be cosmetic probably needs a prior auth, such as, say it, say it.
Blepharoplasty.
Blepharoplasty. Since I've had it done.
Yeah, and I think you've had time practicing.
I've had it done.
Look how pretty those are.
So it runs in my family, so if you see my dad, you'll know. So if your upper eyelid is sagging and obscuring your vision, I think it's 15%, Medicare will pay for you to have an upper eyelid lift.
Bonus.
Yeah, so I had to pay because I didn't have enough obscuring of my vision.
But you look good.
But if you have Medicare clients, I have clients, their eyes are really sagging into their eye, Medicare will pay for that. But it's going to require a prior authorization because it could be it could be your doctor trying to work the system because your doctor likes you. So eyelid,
vein ablation,
varicose veins. Now, varicose veins can be very painful.
Very painful.
And I know a lot of women that have
very bad for leg health.
Yeah, so if you're only doing it for cosmetic reasons, no. But if you have pain, yes. Same thing with nose job, can't breathe, and Botox.
A little bit of Botox for the migraines,
or
the TMJ.
The TMJ, and then paniculectomy. So when people have a lot of extreme weight loss, they have all that extra skin. They can't remove it just because it's unsightly. It has to have a medical basis. And then it will pay for it. And there's a couple other things that original Medicare requires a prior auth for. Implanted spinal neurostimulators, cervical fusion with disc removal.
Yeah, that sounds important.
There's a complete list available, but that's basically it. Those 5 cosmetic things, and then those other.
So let's recap and give a hearty W2 WTF? I can't talk today. Why is this primarily being phased in 2026? Why?
I don't know. I can't find anything. Prior authorizations are one of the biggest black eyes we get. People are mad. When they're healthy, they love their insurance.
Absolutely.
They love the price.
Yep.
They love the extra benefits.
But when they need their insurance,
When they're sick,
it's not going to.
this unnecessary hurdles, unnecessary delays, and their doctors are mad, and their doctors are bad talking to insurance companies.
We don't write this.
And
we
maybe
just
bad
deliver.
talking us. Yeah, so there's not a lot for you to get out ahead of this other than the fact that we know that CMS has stepped in. It will get better, definitely, by 2026.
2026.
I suspect it will get better sooner than that, even though
God, I hope
it's
so.
not.
The only way to coach your clients on this is to just be prepared that this could happen.
Right. Thanks for watching. Tune in next week.
Good telling, folks.